So, what is that analysis for you as an expert for the menstrual cycle analysis? If the female is coming to you with a specific symptom, it could be pain, it could be, heavy flow, it could be unpredictable cycles. So, could you walk us through your history taking and then what's happening next for that female?
Absolutely. So always starts with the history as far as what's going on. If it's a matter of something that is significant or, causing them to perhaps miss school or work or life because of it, then we always will start directly with medical evaluation, which typically involves some detailed lab work. We do a really deep dive. Most of our patients get labs done, and we're checking about 30 to 40 different lab tests in order to determine what's the true underlying reason that something is going on. So we typically will start with that. Sometimes it includes an ultrasound, which is pretty common, especially in our teenagers that are having painful periods or irregular cycles. And then from there, we also get them paired up working with one of our fertility educators in order to start really tracking and charting their cycles. Because again, as I mentioned earlier, if we can help to identify is ovulation happening, yes or no, as well as when it's happening, that helps give us a roadmap from day to day. What else am I experiencing? Do my symptoms seem to align with when I'm ovulating right before my period starts? Do they maybe have no rhyme or reason whatsoever? And it's akin it to if you are keeping a food diary, right? If we are trying to figure out what I'm sensitive to for foods, we're going to write down every single thing that happens in a given day and then look back. It's the same idea with the menstrual cycle. And we talk about the menstrual cycle as being a vital sign. So, similar to how we would have people track a food diary or your blood pressure readings, we track what's happening with our menstrual cycle each day. And that allows us to then start to identify patterns over time as well as to time our interventions.